One of the most common questions asked by a pregnant female from her obstetrician is about having sexual intimacy during pregnancy, whether they can have it or not. So today we are going to talk about this, and I am Dr. Priyanka Garg from Max Hospital, Dehradun. I am a consultant in Obs Gyane department. Of course, you can kiss, hug, cuddle and have foreplay in pregnancy, but having sexual intercourse is also allowed in an uncomplicated pregnancy. In some conditions, your doctor may ask you to refrain from the sexual activities. They are like in condition when your placenta is low down, which we call medically a term placenta previa. In some conditions, when your cervix is very short, which is also called cervical shortening or cervical incompetence, or in some conditions when you have vaginal infections or you have on end of uterine contractions, so that you does not go into preterm labor or any abortion process. In first and third trimester, one should be cautious while having sexual intercourse, but in mid trimester, yes, it is completely safe and allowed. Using condoms are always a good idea to have sexual intercourse during pregnancy, because as we all know that it not only prevents the vaginal infection, but it also prevents the prostaglandin release by the semen, which can cause uterine contractions and lead to preterm labor in last trimester of pregnancy. Now, when we talk about having sexual intimacy after the delivery, we have to remember one important point, that you have to ask your obstetrician that if you can have sexual intimacy or not. Your gynecologist may ask you to wait for 4 to 6 weeks or so to resume the sexual activity. But one has to keep in mind the period of lactational amenorrhea which follows the delivery, where menses can be irregular and ovulation can be infrequent. So one has to use contraception each and every time they get sexually intimated, so that proper spacing between two pregnancies can be done effectively. And for this, you can go see your doctor and seek the contraception advice. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.